Have you ever wondered, if the robot performs the surgery, can things go wild with the robot taking control? In today's episode, Dr. Sujata Gupta will demonstrate how the surgeon is always in control of the robot, and also some curious details to better understand the safety of this state-of-the-art technology. Welcome to Robotic Surgery Explained.
Hello, I'm Dr. Sujata Gupta. I'm a consultant gynecologist and a robotic surgeon, and I decided to make this short video to demonstrate how robotic surgery is done. The reason I'm making this video is because a lot of times patients ask, how is robotic surgery done? And sometimes they think it's the robot that's operating. So hopefully I'll be able to demonstrate how I perform robotic surgery and how your surgeon is 100% in control of the robot. So robot cannot do anything on its own, and your surgeon controls it all the time. So what you'll see is this is a surgeon cart, surgeon console, and your surgeon sits here, and these are hand controls. And this is where the surgeon will put his or her head inside to see whilst operating. And at any point, if surgeon's head moves out, which means the surgeon's not directly looking at the surgical field, the robot freezes. So nothing will move. So I'll demonstrate that. So my head is in, and I can move my instruments. I can think things. I can move things around. And essentially, whatever surgery I perform it, I have very precise movements, and I can do what I want to do. Now, what I would like to show you is I'm moving things, and I move my head out on the count of 3. 1, 2, and 3. And you can see now, everything's frozen. Even if I try and move anything, nothing will move. I'll put my head back into the console, run back in, and I can move my hands again. And every movement, every single movement is finely controlled by me. So if we look back at how my hands move, and how the instruments move. So let's say I want to move this from here to here. I want to move this. So hopefully you could see that as my fingers move, instruments move. Nothing is moving on its own. No machine, no robot is moving anything on its own. One of the advantages of robotic surgery is that it gives me an additional arm. So what you'll see here, so these are the robot arms. And if I show you, one arm is holding the camera. And the advantage of robot holding the camera is, unlike a human such as a surgical assistant holding the camera, people get tired. Robot arm will not get tired. So for long cases where I sometimes would be operating for 3 hours, 4 hours, this is going to hold and stay in a position which is comfortable for me to work with. And if I want to change the position, I can change the position myself. So I know where I want to see, and I can take it there without having to ask somebody else to do that. The other advantage is, instead of most, surgeons have 2 hands, a robot gives us 3 arms. So 1, 2, and 3. The 4th one is holding the camera. And what that means is I can use the 3rd arm for something else. For example, I want to hold something out of a surgical field. I can use that as a retractor. So I'll demonstrate how I can control all those 3 arms. So, right now, I have control of two instruments. Just for demonstration, I'm using a pair of scissors and a needle holder. Now let's say I want the third arm to come in because I want the third arm to pull something out of my surgical field. By tapping with my controls, I can swap from my needle holder to, let's say, a grasper. So I'll do that now. You can see that I'm at the moment controlling needle holder and scissors. And now you can see I'm in control of a grasper. And you saw that how quickly and easily I was able to swap between the two instruments. And that's the advantage of robotic surgery, where you've got an extra arm and it allows you to do more complex work